I am Megan Tamasia, part of the organizational development team. And if any of you have been to any of our sessions before, really just want to say, love chatting with all of you. So please, if you have questions, comments, anything like that, beyond this session, please feel free to reach out to me. Certainly reach out to Shayla as well in the professional development team. But if you have something specific for me or organizational development, please feel free to reach out. We are always available to help as best we can. All right, so we are going to talk about de-escalation techniques today. I guess just to get us going, I do want to know from you all, just to kind of get us on the same page, when you hear de-escalation, what's going on in your world that you think I need to de-escalate this? What does that mean to you? Is it in person? Is it over the phone? How does that sort of relate to you in your daily life, do you think? Just throw it in the chat for me. So I'm seeing lots of great responses in here. So verbal interactions between staff, yeah, absolutely. So we'll talk about that today, that it's certainly yes, between maybe you and patients, but of course between you and your teammates, between other staff that you interact with day to day. Conflict that needs to be stepped down. Oh, I like that phraseology, Rose. I really do, because it's not just about saying, we're going to solve this, right? It's not about saying like everyone's going to leave super happy and bubbly, but it really is about taking that step down to say, how can we start to diffuse or de-escalate this situation? Wonderful. So thank you all so much. Uncomfortable or upset patients. Yes. I think that's what I think about a lot with this, is just those patients who do come to us for amazing care that we provide, and then something happens along the way and it needs to be de-escalated. Great. All right, so today we are going to cover just a few things. I always like to throw in an agenda, and I'll tell you why. Some people hate them, some people need them, and I appreciate both sides, so you get an agenda today. So we're going to talk about really the importance and impact of de-escalation, and just really why that we continue to talk about this, why it's important in your day-to-day life. It is, yes, stepping down that situation, and it makes just for a happier situation, but why is it so crucial to continue the conversation? We're going to talk about why these situations might escalate, why things do reach that sort of hot button point for you. And then we're going to start to sort of get into your day-to-day and just really say signs that that situation might be escalating for you, and really what you can do about it. So we'll get into some techniques you can really stick in your back pocket today and take with you, make part of your day-to-day verbiage or day-to-day action to help you along the way. And then we'll wrap up with certainly, digging in for any questions, comments that you all have, and talk about resources that are available for you to help out with this, because we know that sometimes it can feel like a big hill to climb if you are in the moment, things are swirling around you, and you just maybe need a little bit of assistance along the way, or certainly maybe even after that situation happens. So I'll be coming to you all throughout for your certainly your comments, a couple of different poll questions that I have. So please continue to throw things in the chat. That's always great. It makes for a wonderful interactive experience. All right, let's press forward and hope and pray that my screen does not turn black. All right, here we go. So first thing that I want you all to throw into the chat now, I just want to get a pulse check, truly. So how often do you feel like you need to de-escalate a situation? Again, this could be over the phone, this could be in person, this could be with a fellow staff member, it could be with a patient. So, you'll see on here these different numbers. So maybe you don't ever need to, it's just not in your world. So maybe that's a 1, and it goes all the way up to, maybe once a day, or it feels like quite a bit of your encounters. It feels like every encounter, it's just happening more and more. Okay, so I'm seeing lots of different responses here, really wide range. This is really good to know. So some people, this might not be as typical for you day to day, but let me tell you, still, this will help you if it does ever occur. And then right up to those people who say, this is happening every single day, maybe at least once a day. It's sort of a normal expected occurrence. So again, can kind of get it into your muscles to continue to work. Thanks, you all. Okay. So good variety, good variety. So why is this important? Why are we having this conversation, right? So we want to just kind of pinpoint this and again, get everyone on the same page here. It's so critical to safety. I think we know this, right? So whether it is someone's physical safety, their emotional safety, psychological safety, whatever that means for you, we have to remember that as well. It does affect you, right? It affects the patient care. It can affect your relationship with your manager, with your teammate. So that overall safety and well-being. You also want to make sure that you're getting that accurate information to and from that person. Again, certainly on that patient perspective, you want to make sure that they are getting the information that they need and that you are getting the information from them, whether it is right there at the bedside or maybe later on you're talking with a fellow staff member and just trying to debrief on what happened. Okay. And then the last two on here, of course, patient experience and employee experience. We want people to have the best experience possible. Yes, we want to get amazing scores on the Press Ganey surveys, right? We want to see that great feedback come in. But even more than that, we want people to walk away saying that they felt heard. And even if, and I really want to stress this, even if you don't leave in agreement with someone, at least you left feeling heard and they left feeling heard, and that will help them want to come back and feel safe or continue to want to have that good employee relationship with you for that employee experience. Because let me tell you, the impact is huge if it doesn't go well, if we don't escalate things in a good way, right? It could mean everything from a poor reputation. And let me clarify this a little bit. When I mean by poor reputation, yes, certainly it could be like, oh, I went to this particular clinic or I talked with this particular provider and I didn't have a good experience. So now that's a poor reputation. It could even be in general that you yourself get a poor reputation of how you deal with something, or you've worked directly with someone and you say, you know what, I don't want to get put on the same shift as that person because they're really combative. So we think about the impact of even that reputation because that does make or break someone's day. Misinformation, right? We want to make sure we're getting the right info, especially when it comes to patient care to people. And if we're not de-escalating things in the right way, then that can cause a roadblock there. And that directly goes into that patient mistrust. If they don't feel like that they're being heard, if they don't feel like the information is coming to them in the best way, that leads to that mistrust or misinformation along the way. So again, just thinking through something as simple as a disagreement or someone feeling like they're feeling rushed over the phone, that can lead to these steps. So just really important to think about as we de-escalate why this is crucial. And then let's talk about you all, right? Let's talk about the employee impact of this. That frustration. If you were a 5 on that scale and you say, you know what, yeah, about once a day, I deal with this, that can very easily lead to certainly frustration, right? It can also lead to that burnout, that kind of buzzword that we talk about a lot, that feeling of, I don't even, it's, Sunday scaries or whatever you want to call it. Like, I just don't want to be there. I'm now gonna, start to look for maybe another job somewhere because I don't feel like that I'm getting the support and I don't feel like that I want to walk into that environment every day. So it can have a tremendous impact. And then let's talk about the danger, right? The actual danger to the employee or the patient. Because if this is getting to the point where it's not being effectively de-escalated, hopefully it's to the point where you're de-escalating and it's something where you feel like, okay, we reached sort of an impasse here, we can move forward, we can give the information we need to or get the information we need to along the way. But if it escalates to that physical violence standpoint, right, that presents a danger to you, to the patients, to visitors, all the way around. And if you've ever been to the Crisis Prevention Institute trainings that we've had as far as de-escalation, things like that, that Jeff Farmer's team puts on, they talk a lot about that physical violence and that workplace violence that way and how to encounter that and deal with that. Has anyone been to that training before from Jeff Farmer's team in the Crisis Prevention Institute? Just give me like a quick thumbs up or a yes in the chat. Awesome. Yeah, I know that a lot of us have along the way. And then certainly one of the big impacts, right, is employee turnover. Again, if you've reached that point of burnout, if you've reached that point of just consistent frustration, we're going to start losing really great employees, really great teammates, really great leaders. So this is really critical along the way. Yeah, Kate, I agree. It was excellent. Yeah, so I will fully tell you all, as I was kind of putting this presentation together, it was really important to me to understand the scope of what else was out there as far as the training. And so I actually got to go through that training with Jeff Farmer Really amazing things. And I chatted with him just to kind of let you all know. I said, hey, we're doing this presentation, and I want to make sure that we're giving people information that is certainly not contradictory, right? We never want to do that, but also just kind of adding on to it. And I loved what he said. One of the things he said was absolutely de-escalation techniques, workplace violence techniques, how you approach it. It's like an onion. There are so many different approaches. The more you dig into it, there's more, more and more different ways that you can encounter and de-escalate. So yeah, absolutely. All right. So, one of the things I want to talk about, and one of the things that I learned from different teams as I researched this presentation, was really the potential causes and why these situations are escalating to the point where people are either verbally or physically getting very, very upset. And so, I want to just throw out a few that I heard, and then I definitely want to pick your all's brain about what you've encountered too. So, fear and worry. Somebody, let's say a patient, right? They walk into a situation, they've been told they have a heart condition. They're upset, right? They know that they have to go in for a procedure. They're scared. And so they walk in there. And so immediately their emotions are high because those situations are critical and high for them, right? That's what they're bringing to the table that day. So fear and worry can already put up that roadblock and already walk into a very simple conversation, maybe where you're just confirming some information over the phone and say, this person's already escalated. They're already scared. And so if you are encountering that roadblock from them, that might be why. Health reasons. Okay, so somebody might actually have a disorder that is making them be, maybe they're on medication that's going to make them a little more aggressive, right? Or just not really understand the information that's coming their way. Maybe they're simply not feeling well that day, right? Or if we're talking about your fellow employee, maybe that fellow employee is just having not a great day that day either. Maybe they're under the weather. We were just talking about, like my kid is not feeling well today. It's swirling all around us. You never know what people are bringing to the table. And that could be just a simple reason why someone already enters into that conversation a little bit escalated and kind of quickly goes that direction. Maybe that person feels unheard or uninvolved. Let me ask you this, just a simple sort of scenario outside of the Methodist world here. Let's say you go to a restaurant and you say, I really want to try this pasta dish. It looks really good. Been craving pasta all day, but I'm allergic to shellfish. Is there shellfish in this? Okay. If the server says, yeah, pretty sure, I'm good. Yeah, that's fine. It's fine. I think, yeah, I'm good. I think I would be a little bit nervous. And I think maybe you all would feel maybe the same way too. You would feel maybe unheard. Again, just a very simple scenario where you're saying, I feel unheard, and that's already making me a little nervous. Maybe to the point where I feel like the server is not listening to me. I'd be a little nervous to eat that food, maybe if I did have a really severe allergy. Who knows? Maybe it escalates to the point where you say, you know what, let's grab our stuff and go to another place. Again, just that simple feeling of not feeling heard, not getting that information, not feeling involved in the process can really make or break a variety of different scenarios. And then you take that and you place it into maybe when someone's health is at stake at the hospital, when someone's family member's health is at stake at the hospital, that can certainly lead to already the situation escalating for them. Lack of medical literacy. This is one that I had a really good conversation about with some of our subject matter experts. Just the different levels of medical literacy that people are entering into the conversation with. And I'm talking about patients or maybe patients' families or visitors at this point. Because if you are trying to explain to them, this is what is happening, we understand that this patient is going to have a catheter procedure, whatever it is, right? Maybe they don't know what that is or what that entails or why that means that, for a specific procedure, they can't have food by mouth after midnight, whatever that is, right? So again, they're not on the same page as you. And I really want to emphasize that because so often, so many of these scenarios can be a little bit de-escalated pretty quickly if we just get on the same page and acknowledge that people are bringing these different things to the table. And then the last one is just really personal stressors. Let me ask you all, how many of you, and you don't have to go into detail, but how many of you felt rushed this morning? either going into work or maybe finishing your shift and going home, whatever part of the day you're at. How many of you felt rushed this morning? Yeah. Yeah. Always. It happens, right? Again, we're bringing our lived experience to the table and we can't help that. So let's say you were rushed already this morning. Maybe you got into a fender bender on the way into work. Maybe your kid was just dragging their feet trying to get out the door and you're like, get the bag, let's go. We're late, right? So you're already entering into the situation, already carrying a little bit of that baggage. And if you think about that from your perspective, think about how that other person, whether it's the patient, the family member, a fellow employee, maybe that there's some conflict arising with them, thinking about what they're bringing to the table as well. We got a resounding yes, yep, always to that, right? So just think about what people bring into the table each day. What else? What other reasons have you all seen why maybe you see immediately stepping into these situations that are escalating? What other reasons pop up for you? Just throw them in the chat for me. Ooh, Nicole, historical relationships, unmatched expectations, mixed information. Absolutely. Maybe someone told them something different from what they're hearing right now. Anxiety and depression. Yes, absolutely. Absolutely. Nicole, feel free to either unmute or just throw it in the chat. Don't want to make anyone come off mute forcefully. But for historical relationships, just to clarify, do you mean maybe they've already had a tough situation with that person before? Yes. Okay. So yeah. So it's already, the track record is there. We know that whether it's a patient or a fellow employee, it's just how it always goes. Absolutely. Biases. Yeah. Bad prior experience. Bias. Tracy, absolutely. Right. Donna, absolutely. Bad prior experience. Because we bring those perspectives, those lived experiences to the table. We talk a lot about this in other sessions that we do, that biases, yes, can be, of course, gender, racial, age, all of these things, right? They can also be something as simple as this idea of recency bias. Maybe you had a bad interaction with them recently, and that's already coloring how you're seeing them today, right? Maybe it was a patient, and just even earlier that morning, you stepped into the room and there was already some escalated situations. So you are dreading going into that room a little bit later in your shift to check in on them, right? So, however, that comes to the table, great perspectives, you all. And speaking of perspectives, I want to take just a second to dig a little bit deeper on kind of what people are bringing to the table. Because we have these situations that pop up, right? And you might see things one way and say, well, this is the correct information, right? Talking about misinformation or mismatched information. Well, I feel like this is the correct information based on what I know. Maybe your fellow employee or the patient says, well, based on what I know, it's quite different. And so it becomes an escalated conversation, right? Because you all have very differing perspectives, whether that's just what you have been told along the way, or maybe even how you view the situation, whatever that means. So a big way to start to de-escalate, to get into these de-escalation techniques, is to even acknowledge we're all bringing these different perspectives to the table. So you might think it's a very simple, well, I'm right, I just need to get this basic information from them or give them this basic information, but think about everything that's coming to the table from them as well. And that's really how you start to find that way forward, okay? So we're gonna do a quick activity here. So in the idea of perspectives, tell me, what do you see in this picture? What do you think this is a picture of? Just throw it in the chat for me. Nicholson's turtle shell. Ooh, floor tile, linoleum or ball, paving stones, a bug, turtle, scales, pavers. I like that the pavers have been, no idea. Yeah, absolutely. Wet pavers. Yeah. So this is, a lot of you nailed it, right? This is a picture of a turtle shell. But here's the deal. You were all correct because you all shared a different perspective there. It's not about being right or wrong. That was your perspective in the moment. It could have been wet pavers, right? You really could have seen that. And again, that comes from your own perspective and lived experience. Maybe currently you're redoing your backyard, and so you're in the midst of picking out pavers. So that was just top of mind for you. You never know, right? So let's do one more. What does this remind you of? Simple question, but different perspectives. Birthday. Lots of birthday candle. Ooh, at Christmas Eve, yeah, cake, even digging deeper. Remembrance. Yeah, so this one, I think, a lot of people said right away birthday, but I got some great Christmas Eve, remembrance, maybe a candle really makes you think about, a candlelight vigil. Again, just simple things to emphasize. We all come from very different experiences. And so we're all seeing things in a slightly different way based on what we bring to the table. Okay. Miller's Law, I think, is interesting. So just this idea of to understand what another person is saying, you must assume that it is true and try to imagine what it could be true of. And I love this phraseology of you and try to imagine what it could be true of, because it could just be true from their perspective or from their lived experience. But it's always good when you're in these situations to pause and say, this person really believes what they are saying is true. They are really saying from their perspective, that's what happened. This is what they need. This is why they're frustrated. And this is why that you're being rude, whatever that is, right? And so just taking a moment and saying, what is it true of? Is it true because they had a previous experience with me that led them down this road? Is it true because they received misinformation before? So again, really taking the time to think about what is it true of? Where are they coming from for this that could mean that it's true for them? So think about that as you go into these conversations or situations. All right, so let's talk about kind of knowing what people are bringing to the table. Let's talk about when you find yourself in these situations that are escalating. All right. So just some simple things that you can look for in a situation. And I'm going to go through some of these. Some of these might be things that, of course, you've thought about before, but continue to think through these. The repetition really helps to build that muscle memory so that when you're in that situation, you can start to identify, okay, this is happening. The situation is probably escalating. So verbally, right? We're going to talk about verbal and nonverbal here. But this idea of the raising voice or pitch. I once had a session where someone shared that someone could always tell when she was upset because the pitch of her voice would start to get a little bit higher, and so they knew how upset she was based on the pitch that she gave them. There's even something like that along the way. If you start to notice a difference in the person's voice, maybe from even when they answered the phone or first greeted you in the hallway or in their room, start to identify that. Maybe they're interrupting you. Again, big indicator that they're not in the mood to listen to the full sentence. They're immediately interrupting. They immediately want to get their perspective out there. Negative language, right? So talking about things, this is bad, you're rude, this situation doesn't make sense, you're not helping me, whatever that is. So it starts to take a turn towards that negative language. Sighing. How many of you have ever been in a conversation where, the person maybe was just as friendly as anything else with their words, what they were actually saying, but they were just giving you big sighs along the way? Has that ever happened to anyone? It certainly has to me, where maybe you start to pick up on these sort of nonverbal, right, or paraverbal type of indicators where you're saying, oh, this isn't going well. This is starting to go down a road that I didn't mean it to go down. Either they're bored, they disagree, but that sighing is really a big indicator. Tone change, right? So maybe just how they're saying it is coming across in a little bit of a different way for sure. So, and then maybe it does go to that threat level, right? So it could be something direct that they're threatening violence against you, against others. Certainly, yes, that's a big indicator, very clear indicator that things have escalated beyond where they should. Direct threat, right? So something that could be implied or direct, either, this is happening or I want this to happen, or, if I find myself in this situation, I would hate for this to happen, or, I want this to go down a different route and it better go down a different route or else, kind of a thing, right? So you start to pick up on everything from the very subtle to the very direct, where you are saying, oh, okay, now we are going down a road and I maybe even need to bring in extra help on this. Absolutely. And then I just want to touch on the nonverbal as well, right? So a lot of these are really interesting to explore. you start to sort of realize these, I think, very quickly in conversations. They can start subtle and get to the point where maybe they're more direct or threatening with that nonverbal, with their body language along the way. So it could be something as simple as they start to cross their arms across their chest. That's showing they're not being receptive to what you're saying. Okay. And again, you have to take in the whole picture, of course, because if you're in these situations and maybe the person's just tired and they're just sitting back with their arms across their chest, but if they're already showing other signs that it's escalating, you know that they're not being receptive. Clenched fists, right? Heavy breathing, just like that change in what's going on. Maybe they're even pacing around, their movement has changed, and facial expression, or the aggressive, the posturing, right? Maybe you feel like they're about to take a swing at you, something like that, even something that direct. So again, start to make yourself aware of these so that you can even start to, I think, steady yourself in those moments to say, okay, how can I start to actually use some of these de-escalation techniques along the way, to start to diffuse this situation. All right, so let's dive into some actions that you can do day to day to help yourself. So let's think about for a minute, what can you influence? Some of these situations may feel like that they immediately get out of your control pretty quickly, and that can be frustrating. But what can you control? What can you influence? All right. And that's some of the things we're going to talk about here. So, some of the things like yourself, right? You can start to identify, what am I bringing to the table? How can I help to influence, affect, de escalate this situation? And we'll talk about that. The environment, right? Maybe it's an environment where if you were over the phone, maybe it's a really poor connection, or maybe they're driving, you can tell that they're not super interested in having the full conversation right now. Maybe that's a good indicator that you need to pause and say, hey, this connection isn't great, or I'm not getting the full information right now. I'd love to catch you when we're in a safer position or a better connection, or certainly person to person, right? If you're in a very tiny, crowded room with the person and it starts to escalate, maybe you need to get them to a bigger area where it feels more open so they don't feel as threatened or confined in there. Something like that. You can start to affect and influence that. Education. What I mean by education is truly just taking the opportunity, like showing up today, continuing to say, what else? How can I continue to build that skill set for myself and for others along the way? And then just information. You can start to influence the information, making sure that you have the information that you need to tell the patient or the visitor, or your fellow employee. Okay. So let's talk about the 3 Bs. I love this technique because, again, one of the things you can influence is yourself. Because so often we find ourselves in these escalated situations where you start to become escalated yourself. Okay. And that happens so easily, right? Again, like I think about it through the lens of my kids a lot of the times for these scenarios. But if my 4-year-old starts to throw a tantrum and I'm hungry, I'm tired, I'm rushed, that's not going to end well on either side. I'm not going to be able to have a calm mom voice. I'm going to have a frustrated mom voice in that moment, right? So just identifying, what are you bringing to the table and how can you start to influence yourself? So the 3 Bs are breathe, bias, and backing. Breathing is something truly we all forget to do if we are upset. It happens. You get so upset in the moment that you are just so concerned about what's happening in the situation, getting out your explanation, that you forget to take a deep breath. And so I want us all to do that right now. It seems a little silly, but maybe you're a little bit rushed today. Like we all said, we were kind of entering into the day. Maybe there's a lot of things swirling around you, but just take a second right now. Take a deep breath. And if you're in a situation where that you find has escalated, take a moment, take a deep breath. Again, whether you are in front of the person physically or you are over the phone, you're emailing, maybe you got a frustrated email, take a breath, okay? Bias, and someone mentioned this earlier in the chat, which I love, right? Why these situations escalate? Because we all bring these biased perspectives because we all have different lived experiences along the way. And so we're all saying, I see this in a different way because of whether it's my gender, my education, how long I've been on the job. Again, like maybe I've had previous interactions with the person where that I just feel like they are the worst person in the world and I dislike interacting with them, whatever that is. Try to take a moment and check your bias and say, am I entering into this conversation in a clear way, and in a way that I'm not already coloring it. So go ahead and try to check that bias for yourself. And then backing. And here's what I mean by that. Sometimes you do find yourself in a situation, and yes, certainly if it has progressed to that point of threats, physical aggression, things like that, you might need extra help right away. You might need that backing in that way, whether it's security or just other people around you that might need to help and step in. But backing can also be, hey, I'm not sure how to answer this patient's question, and they're getting frustrated. So maybe it's an opportunity to say, who can back me up? Maybe it's putting them on a quick hold on the call and say, you know what? I don't know that right now. I'm going to find out for you. Hang on for me for 10 seconds, and I'm going to ask my supervisor. And that's okay, right? If I don't know, I'd rather somebody say, I'm not sure, I'll find out for you, than for them just to be like, sorry, I don't know, deal with it, right? So just take a second and think about what backing can you have to really be successful and to de-escalate the situation. So think about those 3 B's along the way: breathe, bias, and backing. Any questions so far? I do just want to check in with you all as we're going through this. All right. And of course, something that you can help to influence is listening. This is a skill that is certainly learned. It's a skill that we also all need to practice. And yes, this can be a very effective de-escalation technique, because if you are in a situation where there are words swirling, there are actions swirling around you, it can be very easy to stop listening and neglect this. So we want to talk a little bit about active listening. So active listening really is not only hearing, right? I'm not only hearing what you're saying, but being aware of their thoughts, feelings, perspectives. Again, that takes you back to sort of pausing and saying, what are they bringing to the table? What am I missing along the way, right? So you want to ask yourself a couple of questions as you chat with this person. Why am I talking? Am I truly listening? Or have I already been sort of planning what I'm going to say back to the person, either because I'm frustrated or because maybe I already know the answer, so I'm just going to go ahead and interject? And I've been sort of half listening along the way because I've seen this movie before. I know how it's going to play out. So I'm just going to go ahead and plan what I'm going to say next. And while that happens to us all, I want to emphasize this is very normal, right? Taking the time to say, why am I talking? Maybe I just need to be quiet for a second and really listen. Because not only is that going to get you the information that you need, but it's going to indicate to that other person that you actually care to hear them. Okay. Am I still listening? Okay. Maybe we're multitasking. I know that sometimes we actually have the ability to multitask along the way in these situations. Maybe you're on the phone. Maybe you're quickly texting someone as you're trying to talk to a fellow coworker, right? But take a second and really think about, am I still listening? You can pause on whatever you're doing. You can send that text later. You can, fill out that paperwork that's right next to you on your desk a little bit later, okay? And then what am I missing? Okay? So along the way, you really want to make sure that you are getting all the information from them, that you're really taking the time to say, let me ask you a question. Let me follow up on this, okay? And I want to challenge you all to think for a second about what kind of listener are you? What's kind of your first perspective that you bring to these conversations? So I love this because you think about, how do I usually listen? And this will tell you a lot about how you approach these situations. So it might be task oriented, right? So you might be just saying, you know what, I'm someone that just needs to get this done. I need to fill out this form. I need to get the information that I need. And again, with all of these, not saying these are bad at all, but it's just how you approach and understanding, if this is how I typically approach, knowing that you might need to pivot from time to time to help de-escalate a situation. Maybe you're more of an analytical person, right? You're going to analyze the situation more from a neutral point. You're saying, tell me more about that. What does this mean? What makes you say that? So you're trying to get more information and really analyzing the situation. Maybe you're more of that person who really likes to build the relationships. You're more of that relationship person. You're coming at it more from the emotional standpoint. Okay. And then critical. And this happens to us all. Maybe, again, you're having a bad day. Maybe you've had previous interactions with this person that have been tough before. So you're already coming into it as a critical listener, where you're already judging the content and the speaker before it really even comes out of their mouth. Okay. So I want to talk about verbal techniques along the way as well. Okay. Verbal de-escalation. Here's an amazing formula you can use for yourself and as you are helping others as well. So think about your tone, okay, how you are saying something, your volume. Maybe that's something that you need to check to say, am I giving out a really loud volume at this time because I'm frustrated? Maybe that's your indication to lower the volume. And more often than not, if you are trying to de-escalate, whether it is your tone, your volume, your rate of speech, or inflection of voice, they will match you a lot of the time. If you escalate to the point where you are almost shouting and speaking very rapidly because you're frustrated, but then you take a moment and you breathe and you calm it down, a lot of times that will even start to diffuse the situation just on that very basic level. So think about this formula along the way to de-escalate yourself and others verbally. And I want to also tell you about feel, felt, found. So love alliteration. So this is hopefully helpful along the way. So if you do find yourself in a situation where you're just hitting a wall with someone, they're constantly upset in the conversation. They're saying, I already gave this information to someone else before. I don't need to give it to you. Think about using this technique of feel, felt, found. So feel is really this idea of expressing empathy. And so you can even be very direct with this by saying a phrase like, I can hear that you feel this way. You're acknowledging, you're being empathetic with them. Okay. Felt, right? So you're acknowledging their concerns. So you're saying, yeah, like this is something that I've certainly heard before. I acknowledge that that might be frustrating. Okay. And then found, this is helping to provide a way forward. So this is something that might help. Or let me give you more information because I can hear that you feel very frustrated. So I would like to provide you with some additional information along the way that might help you. So this idea of feel, felt, found to really help to have almost I've heard it referred to as a fogging effect for people so that they feel like that they're not in this cloud of their own emotions, but you start to draw them out a little bit by providing your own language and acknowledging their emotion. So let's do some, instead of this, try this. How many of you have ever been in an escalated situation, either at work or at home, and someone tells you to just calm down? How does that make you feel? Or is it effective for you? Frustrated. Yeah, frustrated. Even more, yeah. It is, again, like it escalates. Maybe the person thinks they're being helpful by just saying calm down, right? Angry or unheard. Absolutely. The same. So maybe instead of this, again, thinking through that lens of feel, felt, found, this idea of this must be a stressful time for you. I can see that you feel this way. Again, not coming at it from like a calm down, like we see that you're upset, but really saying like, I'm going to take a second and just acknowledge what you're doing here because you are a human being and you're feeling this way. So in a way that helps to start to calm down the situation without using that phrase that can sometimes irritate. I can't help you unless you listen. So yes, we understand that sometimes we have to provide these clear guardrails, boundaries for people. If you are trying to provide a safe information setting, provide them an information time when you can get the appropriate information to them and from them. But instead of saying, I can't help you unless you listen, maybe try, kind of acknowledging what's going on again. Others have felt this way. But for your safety, to provide the why for them, for your safety, for your best experience possible, I really want to make sure to get this information to your care team. Again, you're helping them. So again, they might start to feel that you are trying to help them, that you're on your side. So that wall starts to come down a little bit, okay? We just need to get this information. So I've certainly been here where you're like, you know what, we've been talking for 25 minutes. I just need this information from you because I've got 10 other calls. I've got 10 other patients to see, whatever that looks like, right? But again, this can make that wall even stronger for the person because you have also reached a point where you're frustrated at this point. So maybe instead of saying that, you say something like, again, you are your best advocate, trying to tear down that wall a little bit to say, we have found that the more that we know, the more that we can support you, because that's the goal, right? We want to support you. We want to make sure that you have the best experience possible, whether it's the patient, patient's family, coworker. So you're your best advocate along the way. So just some ways that you can find to do this. So think of your own phraseology with this. But again, instead of just throwing up the roadblock for them, throwing up that wall for them, think about how you can start to say, I hear you as a human, and we're going to continue to have this conversation because it will ultimately benefit you, and try to go forward from there as well. Easier said than done. But again, if you have some of these phrases in your back pocket, it can help to de-escalate. So just to talk about nonverbal techniques as well. So I always love this stat, right? That 93% of communication is nonverbal. Okay. So that means that even beyond the words that you are saying to someone, beyond you saying, I feel that you are upset and I'm sorry that that has happened, or whatever that looks like, right? Just being able to understand their body language and your body language. And let me tell you, even if you are over the phone, this comes across, right? So body positioning might be part of that, of course, how you are holding yourself, if you are tense, if they are tense, those paraverbals like we talked about. So if you have an angry tone or a constant sighing along the way, I know that I'm guilty of this. If I'm, let's say, even in a meeting, maybe somebody says something that I don't agree with, you might just say something like, ugh, right? That's happened. It's happened to me. I'm sure it's happened to a lot of you, but that makes a big impact on the situation because they already know what you're communicating without saying an actual full word from you. And I always want to encourage practice, because sometimes, again, you're not aware of how you are coming across, or maybe they're not aware of how they are coming across. So even try it in a mirror, right? How does your face look when you're talking with someone? How could you make sure that you are being direct, but you're kind of acknowledging your own tone along the way? Maybe that's feedback you've gotten in the past. You never know. So just practice along the way. And certainly when you're not in an escalated situation, that's ideal. So just some things that you could have along the way that could be a plus or a negative in these situations. All right. So you want to keep a relaxed and alert stance to the side, right? Especially if you feel like that person is becoming more aggressive, you certainly want to step to the side to not have that direct alleyway to you. You don't want to stand directly in front of the person because, again, that can be very threatening for the person. You might be blocking an exit. And also you might be in the direct line of them becoming actually physically aggressive with you, okay? A positive in these situations when it comes to nonverbals, slow, deliberate movements. Okay. That also helps to slow you down in the situation, and that helps them to slow down as well. So if you are having excessive gesturing, maybe you're just getting very frustrated and you're using your hands a lot, or whatever that looks like, right? That can be very alarming to someone and even escalate that situation even further. So just thinking about slowing down those movements, because that can actually slow down the situation. A positive, again, keeping your hands down and visible. Okay. That can help people feel safe in that moment along the way. And certainly, I think we've been in this situation before, in daily life, where maybe if someone's pointing at you, that can feel a little bit aggressive along the way as well. And then last one, and this one especially, I think goes into phone calls, things like that as well, is if you are maintaining a neutral or attentive expression, right? Or maybe even you just have a smile on your face. If you're on the phone with someone, has anyone ever said to you, you can hear a smile over the phone? And it's true. It's really true. If that person has like a nice neutral expression or a pleasant expression, you don't even necessarily have to smile, but just a nice neutral expression. They're calm. They bring that calm demeanor to the conversation. What can make that go off the rails, though, is if you're faking a smile, right? People can see through that. And even over the phone, it can feel very tense if you're trying to fake a smile or fake being friendly to the person. Certainly in person, you can feel that as well. So just best practices truly along the way is, I would encourage you to be empathetic and non-judgmental. Again, easier said than done. We all bring those lived experiences to the table. We're all in different situations that might escalate so quickly that we don't even realize it. And all of a sudden you're there and things have escalated. You don't have time to, take a big deep breath. It's moving too fast. But try to really be empathetic and non-judgmental and really come at it from that meaning of care, which I know we all do. Actively listen, right? Take the time to say, okay, am I talking? Am I multitasking? But try to be in the moment to really get the information from that other person. Use that calm tone and let that person speak. Again, that might be sort of as, again, my kids, we always talk about like hold a bubble in your mouth, so that makes them be quiet for a second. But really that idea of just taking a moment, be quiet and letting them speak. Sometimes just people feeling like that they are heard de-escalates the situation pretty quickly for them. Behavior meets behavior. That's kind of what we're talking about before, where if you all of a sudden find yourself using escalated language, escalated tone, they will often match that. Okay. But if you start to slow down, use a slower tone along the way, that can certainly help. And make promises you can keep. I think this is just a good rule for life as well, right? But really, if you're in an escalated situation, if you are just trying to get out of the room and you're like, you know what, absolutely, I know it says on your chart you can't have anything by mouth, but you want some chocolate cake, absolutely, I'm going to get it for you, bye. And you just remove yourself from the situation. Really, truly try not to make promises you can keep. There are always ways that you can move the conversation forward and help that person without just being able to say, yep, I'm going to promise you the world and come back with none of it, right? So really think through that in the conversation as well, because you really want to continue to build and maintain that trust with, again, whether that's the patient, your fellow employee, leader, whatever that looks like for you. Okay. So let's practice just for a second. I'm going to have you throw some suggestions in the chat. So I'm going to give you two different situations here. And I really want you to think about how would you approach these situations. So I want you to throw in the chat maybe something you might say to the person, thinking through things that we've talked about today, whether that's feel, felt, found, or just taking a moment to breathe. How would you start to approach the situation? Okay. Again, no right or wrong answers. I'm just curious on your perspective on this. So the first scenario that we have is, I'm sorry. So first scenario that we have is you have a patient that you give a pre-surgery call to who is having a heart procedure and needs a stent. They are unaware of what certain medical terms mean. Again, that comes back to the medical literacy we were talking about. And they are becoming increasingly frustrated as the call goes along. And they actually begin to berate you and start swearing. So what would be kind of your first pass at this to start to de-escalate this situation? What do you think? Again, no right or wrong answers. I'm just curious kind of how you would start to de-escalate this. Yeah, I know this is stressful. Yeah. And acknowledgement is a huge thing that takes you so far in these situations. Yeah, I didn't explain it well, let me start over. I love that. Yeah, let's take it back a tick here. I understand, let's start over. Yeah, there's lots of like, okay, let's slow it down, start over. Yeah, acknowledging this must be really overwhelming. You're having this procedure, it's stressful. Get back up. Oh, I like that, Trish. Yeah, get back up for the medical literacy. Maybe, we want to make sure they have the full details. So maybe it's just you need to check, a different file. Maybe you actually need to get someone else on the call with them. That's going to help them, whatever that looks like. Yeah, absolutely. These are great. It seems you have some questions. Yeah, just acknowledging, yeah, we're not done yet. I'm not just going to give you this information and get off the phone or get out of the conversation with you. Let's answer your questions. Let's tackle this together. Yep. So acknowledging, apologize and acknowledge. Yeah, Lene, I think that's great. Pause and acknowledge their concerns. Yeah, just even being able to say, okay, let's pause for a second, right? Yes, I might have this full list of questions that I need to get through with you and information that I need to get from you, but let's pause because it sounds like we all need to make sure that you have the information that you need and we can feel that you're upset. Yeah, is there another person that they would want to listen in? Okay, that's such a great point. Is there someone else that could be maybe an advocate for them in that situation, or could maybe even understand, or just maybe even hear, right? Just making sure that you have that additional person on there. Yeah, that support person that may be helping pre or post. I love that. Absolutely, absolutely. Great comments, you all. And then the last scenario here, you have a patient who you need to give some important information to and get some important information from. So very typical, right? We need to have that give and take of information. They say they don't have time to talk right now for whatever reason, right? And they say that they already gave this type of information to someone else earlier. Okay. They get so upset and they either want to just, maybe they just want to hang up the phone, or if they're in person, they just want to end the conversation and walk away. How do you start to defuse this? If they feel like it's more of just, I don't even want to deal with this, it's just repeat information over and over again. Is there a better time? Yeah. So maybe it truly is a time thing. It's, if you don't have 20 minutes to talk through this now, let's find a time together. The reason I'm so acknowledging, this, we have already asked you this. I acknowledge that, but we truly need to get this from you because of XYZ. Can we schedule a time? Yeah, when is a better time for your safety? Yeah, Jasmine, that's always great. The why behind it, right? It's not just because we're having fun asking you 3 times for information. It really does have a reason, and a very critical reason behind it. I completely understand. Yeah. I'm sorry this feels way. Yeah, we're acknowledging that they do feel this way. They're not making it up, that they're frustrated. They are indeed frustrated. This is their truth in the moment, whether or not you agree with it. So acknowledging that. Yeah. I love it. Great comments, you all. So I want to leave you with kind of utilizing your resources, okay? And this might be pretty straightforward, but I think it's something great to think about, because you do have your leader that can certainly support you. And by leader, I mean, whether it is someone else on the team that you respect, or a direct, people manager or people supervisor for you, whatever that looks like. Really going to them and saying, how would you handle the situation? Or, hey, I need backup. Or even, and this is really crucial, right? Maybe something has happened and you know that you need to document it, or escalate it even further, that this person might be a threat to someone, right? So letting your leader know among other people too. Okay. So make sure that you're utilizing that resource, because they are there for you. Your team, right? So your team and other teams. And the reason I wanted to put this in here is because everyone has this wealth of knowledge. And so, yes, this might be the first time maybe that you've interacted with this patient and you've had this conversation, right? And so it really frustrates you and it kind of knocked you off guard. But maybe this, your coworker, someone else on your team, has had a very similar interaction with someone fairly recently, and they had a great success using a certain type of de-escalation technique or certain phraseology that helped along the way. So really kind of digging into their knowledge, and that can be certainly within your team, but it can be with other teams as well. And we've even had success with seeing some teams maybe even have a knowledge share, maybe once a month in a stand-up meeting with someone, or in a more formal team meeting. You say, hey, let's just talk about this. Let's throw out some ideas. Let's say this is a scenario that several of us have encountered. How would you approach it, or where have you found success, right? So kind of getting the conversation going that way. And you can even take it to the next level and start to document those things. If you found that, hey, this is just an amazing phrase that someone used, I don't want to forget it, maybe you all start to having a running list on a shared doc or something, who knows, right? But really get those other people in with you on that as a resource. HR, right? I'd be remiss if I didn't mention HR. So again, if you need additional help, whether it's from employee relations, letting your HR advisor know, kind of keeping them in the loop, or even asking their perspective on a certain situation, please feel free to reach out to them. They are there to help you. And certainly on a security note, okay? So if something is happening, obviously these numbers are around the different hospitals. But just to kind of remind you, if there are emergencies where something has escalated, there are these numbers around where you can get security in there if they aren't standing quite nearby. So think about when you might need security and to loop them in. And then certainly the quality and safety note. Notation of the event along the way, or on the event. So this is really an opportunity. You can find this on the intranet. You can just search for quality and safety note. And this is a way where you can log whether it is a workplace violence complaint, whether it is a behavioral instance that you need recorded, or even a compliment. I think it's great that you can also note those compliments, or those, the good catch awards, that sort of a thing on there as well. So make sure that you're utilizing that resource too. And again, that's on the intranet. Some of us, whether it is something where we're maybe newer to Methodist, or it's just not a common practice along the way, do check out that quality and safety note, because that is something to even bookmark, or even have hung up for your team, maybe in the break room, so they know where to go if something like this happens. Okay. any questions along the way. We're just about 3 minutes left of our time, but I do want to open it up if you all have any questions, comments, even things that have worked for you along the way. Maybe this is the time to start knowledge sharing. So I'll wait just a second to see if anyone has any questions or comments that they throw into the chat. All right, I waited the obligatory 7 seconds, but I do want to kick it back to Shayla. Thank you all so much for your attention and time. Really appreciate it. Again, always love these knowledge shares and just to have the conversation with you all. Such great comments in the chat. So thank you.
That concludes the online education. I would like to thank all of our presenters for their experience, knowledge, and expertise. Be sure to subscribe so you're up to date with all of Nebraska Methodist College's continuing education offerings. Thank you.